Neighboring Uganda has been conducting compulsory testing of all truck drivers at the point of entry and exit in Malaba border. This is their situation, a record 30-kilometer traffic snarl-up that extends from Malaba all the way to Buyema, which is about 6 kilometers from Bungoma. It is occasioned by strict testing of any driver who uses the border point. The National Emergency Response Committee today held a meeting directing that Kenyan medical personnel be deployed to all points of entry to ensure testing of a group increasingly under scrutiny.
The National Emergency Response Committee has directed the following. 1. Testing of truck drivers to start immediately at all border crossing points.
The medical teams as well as security officers have been deployed to the Namanga border, Malaba border and all other entry and exit points for trucks ferrying cargo. The government adding that other than counties that have been marked as hotspots, mass targeted testing will also start in areas with a high number of the elderly.
We will also be targeting vulnerable groups. You know very well that people who are aged and who may have comorbidities are also at higher risk.
Today, 12 new cases of COVID-19 have been reported, totaling 355. 8 from Nairobi and 4 from Mombasa. In Nairobi, 2 from Kibera, Karen, 1, Dandora, 1 case, Isli, 1 case, Kasarani, 1, South B and Umoja, 1 each. In Mombasa, Mvita had 1 case, Mishomoroni, 1 positive case, Bondeni, 1 and Borsheba, 1. Government noting that recovery cases are increasing by the day and announcing 8 more discharges today, bringing the total to 106 recoveries, while deaths have stagnated at 14. Counties now been asked to prepare more isolation centers as government focus shifts to the devolved units.
The Ministry of Health, in collaboration with the county governments, to identify COVID-19 isolation facilities at county level 4 and 6 facilities.
Because of stigma of health facilities, pregnant mothers are fearing to go to health facilities. Immunization has now gone down.
The Ministry of Health, aware of the ongoing heavy rains in the country, warns that malaria could be an issue, adding that all health facilities have been equipped to deal with symptoms of malaria that tend to be similar to COVID-19 symptoms.
Mosquitoes are not under quarantine or lockdown. They are still spreading malaria, and the same for other carriers of pathogens. We need to protect ourselves from mosquitoes and to be on constant lookout.
The ministry calling on Kenyans to be more vigilant and observe the set protocols at all times. Stephen Letos, Citizen TV, Nairobi.